Assalamu alaikum, the communication day. First scenario, Mr. Gamal Ramzi, 6 years old gentleman. He was admitted 3 weeks ago with extensive intracranial hemorrhage, transferred to the ICU. His condition was deteriorated and put on mechanical ventilation. After checking his brain stem reflexes, the treating team made a decision that he has brain stem death and to start withdrawal and cessation of ventilation. Discuss the issue of organ donation with his family. You are the senior house officer on call today. You have been asked to discuss this issue with the son, Mr. Sami. Ready, Dr. Radha?
Okay,
أهلا.
ready. Okay, hello. I'm Dr. Mohammed, one of doctor in the clinic today. Am I talking to Mr. Sami, Mr. Jamal, son?
Yes, I am.
Are you next of kin of Mr. Jamal?
Yes.
Okay, I'm so sorry, Mr. Jamal, that we are meeting under such circumstances. Actually, we are here to discuss issues related to your to the condition of your father. So, is it okay for you?
Okay. Mhm.
Okay, could you please tell me, in order to be on the same page, what did you know so far about your father condition?
Yes, doctor, my father admitted since maybe 3 weeks ago, after there is a bleeding in his brain, uh, and actually, I think it was severe bleeding. So they admitted him to the intensive care unit, and they put him on breathing machine till now. Uh, I don't know how extent the severity of his case, and I want to assure from you to assure me about him.
Okay, Mr. Sami, I highly appreciate actually this valid information, and this is reflect how you are a very caring son. Please, do you have like any expectation about the thing that we are to discuss in this meeting?
Uh, yes, I expect that you assure me about his condition, and uh, even with this advanced stage of his condition, health condition, and this deterioration, I am still hope that he recover and become in a good condition.
Yes, I highly appreciate your feeling, and I know this is very distressing time on you actually, but I'm afraid to tell you that actually, despite all the treatment that we are gave for your father, his condition, as you mentioned to me, is advanced bleeding in his brain, and actually, this result in irreversible damage to his vital parts of his brain. For that, our management team decided to perform a special test in order to check the what is called the brain stem reflexes. Do you know? Do you have any idea about this test?
No, what's this?
This test is done actually to check the vital parts that the brain control it, like heart rate, breathing, and actually, unfortunately, the test is confirmed that your father has a condition which called brainstem death. I'm so sorry for that. This means that he has died, but still his heart rate and breathing maintained because he put on a machine. And I want to be very clear and honest with you that the brainstem death means death actually. It is not a coma and it is not reversible. I'm so sorry that I am the one that telling you such very bad news. I'm sorry for that.
What are you saying, doctor? I am became confused actually. How you say my father is died? My father is alive, still alive, doctor. He is breathing. He is a monitor, there is heartbeat. How you say that? How are you, doctor? I am shocked actually from your talking.
This is all right, Mr. Sami. I know this is actually very, very difficult and very painful news on you to hear. And please, if you don't want to continue this meeting, I can just arrange for other meeting. I'm sorry for this. How do you
What you
feel?
mean? What you mean, doctor?
As I mentioned to you, Mr. Sami, actually, this test that was done means that your father condition actually his condition actually is and the damage that happened is irreversible, and actually he is his breathing and heart rate maintained because he is put on a machine, and once he is removed from this machine, his heart rate and the breathing cannot be maintained. And I'm sorry, but I want to be clear with you and to clarify the actual situation.
I understand that you want to kill my father.
I know, Mr. Sami, I highly appreciate your feeling. Be sure that we are here to support you, and we do our best actually to support your father condition. But when he was presented to us, his condition actually was very in advanced stage, and we will try our best. But actually, his condition further deteriorated, and the test that we did. Uh, um, it means that his condition is irreversible, and for that, and as I told you, your father actually did. He is maintained on just his vitals maintained because he is on machine, and this machine even no longer help him to recover. And the team actually decide to stopping the breathing machine, and we will make sure that he is treated with dignity and respect, and we will not feel any pain. So how this seems so far?
Actually, it is. I'm shocked from this news, uh, but I can't see anything about it.
This is all right, actually, and you can take your time. And even if you want to postpone this meeting, and I can arrange for to meet you in another time. If I know this is very difficult on you, I know that.
Okay,
And
no
actually,
problem. Okay.
Mr. Sami, I want also to discuss you something, if you don't mind.
Okay.
Also, it is something actually important, and you can take your time to think about it, and also to discuss even this issue with your family. Some patients, like in your father situation, um, um, may able to donate their organs in order to help to save other people's life. And this is completely your decision, and we respect whatever you decide about this.
2 minutes left.
So how this is it clear so far? What do you think about?
Actually, I am be more shocked about that. You say my father is died, and you want to remove this breathing machines and let him to die, and you cut the hope about that. And then you are talking me about killing his organs. It's a difficult situation, actually.
Um, I'm sorry for that, and I'm sorry to feel in such a bad feeling. And as I told you, you can take your time and even discuss with your family. But I need to tell you that this actually step can help several people who are waiting for organs, and it is just like how can I? It is just like something will belong to him. So you can take your time in order to and discuss with your family in order to decide about that.
Okay.
And I would like to reassure you that your father will be treated with dignity and respect. And it is not an organ donation, which not means not mean we will not discover him or and we will not. This will not also delay the funeral significantly. And this is entirely your choice. And after discussion with your family, and be sure that we are here to support you. Whatever you decide, be sure that we are here to support you actually. And I'm so sorry for this is very bad news um, so do
Okay.
you want any concern? Do you have any worries that you want to discuss it with me?
Time is up.
Okay. Thank you.
Yeah, time is up already, Dr. Ragad. Thank you. Well done. Dr. Hani will comment, then I will comment.
Okay. Well done, Dr. Ragad. You covered most of the things, and it is actually a difficult scenario. And to face uh, two tasks, you want to make breaking bad news of the brain stem death and removing the ventilator. And after a task, the other than task is uh, uh, discussing the organ donation in this situation. It is difficult scenario actually and sensitive. Okay, so we can discuss with the relative as follow. We can explain the severity of the case and the advancement or uh, that the patient is become irreversible brain damage. Okay, this condition is very advanced and there is irreversible brain damage. And can say I'm really sorry to inform you the treating team taking care of your father made a special test to check his response, and they confirmed that your father has brain stem death. What is this brain stem death, doctor? So the brain stem is a part of the brain which is responsible for regulation of the most important function in your body, in our bodies, and it is these functions are essential for life, like breathing, heart beating, blood pressure, swallowing, and in your father condition, there is irreversible damage to this part of the brain, and actually he has permanently lost the potential of consciousness and capacity to breathe. That means your father is technically dead. Silent. Okay. After that, you can check his response. Okay, and sympathy with him. Okay. After that, you can discuss that the decision of removing the ventilator. Okay. Therefore, the treating team made a decision in the best interest of your father's condition to withdraw the treatment and stop mechanical ventilation to let him to die in peace. After that, he can say directly in this situation how he is died, doctor, and he is breathing. Okay, you can respond to this concern as follow. You can say, as I told you, Mr. Sami, your father heart beating and breathing are only maintained using mechanical machine and no chance to resume conscious level again. Okay, and if he continued on mechanical machine, actually even he can suffer a lot of complications like it's sore, a recurrent hospital, and machine acquired infections, which actually may be difficult to be treated. So I am sorry to tell you, no hope to return to life again. Okay, uh, you can you need to be more sympathy. Okay, after that you will open the issue about the organ donation in sensitive, in gentle and sensitive way. Okay, you can start as did your father has any advanced directive or living will or power of attorney, or he expressed any thoughts or wishes before about organ donation. He will understand that you want to talk about organ donation. Okay. Uh, why, doctor, you talking about it? No, doctor. Why you are talking about this issue? You will say, yes, Mr. Sami, although your father has brainstem death, but his organs are still viable. So, in such case, we discuss with the relatives the possibility of donating viable organs to patients who are in strong need for these organs. Really, we have a long list of patients with organs failure who are in urgent need for viable healthy organs. And this actually will improve their life and even will save their lives. Okay, how does it sense? Actually, it is difficult position, doctor. Uh, it is difficult to say you will cut his tummy and like that. You can let me explain how this issue dealt or this organ donation done. Okay, so this will be done by special organ donation team. A clean, regular incision will be done to the body by expert doctor, and the viable organ will be taken, and the wound will be sutured regularly without any disfigurement at all. Okay, and no venereal ceremonies will not be postponed at all. Okay, yes, he will be hesitated to take that decision. It is normal. So you will say, okay, you have some time to think about that, and actually it is your decision and your family, and you can involve anyone of your family members and can arrange another meeting for any queries or worries. If you agree about this procedure, we will sign the consent involving all information about the procedure. Okay, and if you change your mind uh, at any time, you can withdraw from the consent for this procedure. Okay, uh, this is all the comment about the scenario.
Thank you, Dr. Hani.
Okay.
Yes,
Thank you.
actually, I missed this about the wish to ask about the wishes. This is very important, actually.
Yes, this is important point to raise prior to explaining the idea of organ donation.
Yes,
You can
thank you,
even
Dr.
give him a hint. Did your father help others by any way? Why, doctor, you are asking this question? Because now we are thinking to help others by giving them your father organs. Okay. So try to prepare the point by his living during his living, that he help others during his life. So she will tell you, yes, he would like to help others when he was awake, or when he was alive. He used to help others. He used to do some charity with others. So this one will give idea that we are going to discuss very important point, that he can get a lot of reward by donation, by organ donation. So from his organs, he can help other people to survive and to live longer by his organs. Okay, this is another way to prepare for organ donation. Let's talk about the old performance, Dr. Ragad. I think you are too much stressed. Maybe this is because this is the first time
No,
to
this is
perform.
no, not just because I'm such like that in every time, not because this is the first time.
But you know why and how to overcome this?
I don't know. Allah ala Allah.
No,
جدي.
the way to overcome, to practice more.
Doctor, even wallah, even though no benefit.
No, no, no. Believe me, whenever you practice more, you will gain a lot of confidence. You will not feel panic, because I notice all the scenario that you are distressed and panic. Whenever you practice more, you can solve this problem. Okay, believe me,
Inshallah.
it will be solved whenever you practice a lot. The other point I want to add in your performance on the introduction, whenever you have such news, very bad news, you can invite
To
someone.
join. Yes.
Yeah. So do
Okay.
you want anyone to attend this meeting with you? Why, doctor? Anything ongoing? Yes, there is uh, a lot of concerning news today, for example. One more point I want to stress on. Whenever you want to explain a condition, I would like to pronounce the condition and the term in advance. What I want to
Yes.
say, yeah. So whenever you are explaining, for example, in our scenario today, your father has a condition called brainstem death. Have you ever heard about it? No, doctor. It sounds something critical. It sounds something dangerous. Yes, I'm afraid to say yes. It's one of the very advanced condition of the brain, and whenever the patient have it, means he doesn't have any hope to survive. Then explain the condition. But if you start to explain the condition without saying that the term itself or mentioning the term, and you will keep repeating without explaining and without getting the term. Maybe they will minus you because you didn't state that condition, which is brainstem. You were about to miss it, but at the end you mention it. Okay, so
Okay.
I prefer always to mention the term, then explain it. And be
Yes.
sure whenever you repeat something or you repeat a sentence, whenever you repeat a sentence, there is something wrong ongoing. You kept repeating irreversible damage, maybe 3 or 4 times, right?
Yes. Yes. Yes.
Yeah, means
Yes.
that, yeah, means there is something wrong ongoing. It's 1 or 2 times only to repeat or to mention it. Otherwise, you will proceed to the next task, because you have, as Dr. Hani mentioned, 3 tasks in this scenario. Explaining the brainstem death, the second task for withdrawal and cessation of the machine. The third and the last will be for organ donation. And again, every sentence or every task, you have to give the term, then explain it. Your father has a condition called brainstem death. Explain it. Then the team decided to do cessation and withdrawal of a machine, and explain it and why. And the last is, our team also thought about what we call it organ donation. Have you ever heard about this committee before? No, doctor. Then explain it and so on. Okay, in this way. I hope it's clear, Dr. Ragad. Anyway, as general, you know how to approach, to discuss, and to address every concern. Okay,
Yes, okay, inshallah. Thank you. Thank you, Dr. Bassem.
it's okay. Most welcome, Dr. Rahat. Now we will move to the next scenario, Dr. Hani. Your scenario will be posted in the chat box. Give me a second. No, not this
You
one.
can okay. You
No,
can
no.
post it. You can post it in the group also to if any one of our colleague
Okay. Yes, I
join
will.
us. Mm.
Yes, you can see it now in the chat box. Mr. Salim, 65 years old, he was admitted 2 days ago as a case of community acquired pneumonia with curve score 65 score of 5. There was no bed available in the hospital at that time. Therefore, he was admitted in the surgical ward. His line was dislodged and he missed one dose of antibiotics. Later on in the night, his condition was deteriorated and he was transferred to the ICU. Unfortunately, he had cardiac arrest. Trials, trials of resuscitation failed and he passed away. The task, you are the senior house officer of the medical department on call today. You have been asked to discuss this issue with Mr. Ahmed, his son. 2 minutes, then we'll start.
Assalamu alaikum, Dr. Basim and all.
Yes.
While our colleagues preparing this 40 minutes, just one comment I will add to this scenario.
Yeah, Dr. Mahira?
Yes, Dr. Basim,
Okay.
how are you?
How are you, Dr. Mahira? Yes,
Fine, Alhamdulillah.
here you go.
No need to repeat, postpone the meeting several times in the task. First, and if the surrogate sent continue, yeah, just continue. No need to repeat. Is that right? Dr. Basim, correct
Yes,
me.
perfect, Dr.
Yes,
Mahira.
yes.
I was about to mention it, but I forget really.
Yeah.
Whenever you have difficult news, shocking news, and the surrogate is shocked, never ever say, I will postpone this meeting. Okay, because this is your task to sit with this
Yes.
patient, not to postpone
Yes.
any meeting. Okay, continue, Dr. Mahira. Perfect.
Okay. This is my comment. So
Oh, okay,
let that.
so this is the only one? Okay.
Yeah, I have two, but now just we'll wait for that one. This is the important things that I
Very
remember
important.
myself and others
Yeah,
to.
it's very important. Thank
The
you for
things
reminding. Yes,
the
continue.
doctor, yeah, did great, and she did the task. But when we are listening, she's paralyzed that one, the surrogate. No, she didn't take every time the understanding, and this is very bad news, as you have mentioned. Sometimes when we need to cover our task, we miss important point like pausing and take understanding and change our tone. She used sorry, I'm afraid, and something like that, but we need also to change the tone. This is very bad news.
Yes, you're right. But I think she
Because
asked if everything is
2
clear.
minutes and 3 minutes and no pause.
Okay, but I remember she asked him many times if she's clear so far, and the point is clear for him. I think so. So she kept asking
I
for
guess one phrase, guess I many things rush, and she did very great, really. But when we are listening, we need the listening. The listener is not like the patient, the
perfect. Yes,
candidate
you're
who
right.
present.
Yes, you're right.
Yeah.
Yeah,
Best of
I want.
luck to all. Yeah.
Yeah, thank you, Dr. Mehra. I want to say also this advice for Dr. Ragad because this is the first practice. You can listen to the record and see for how long you kept talking, as Dr. Mahira said. Again, don't never ever say, I would like to postpone this meeting if you are not feeling good. The task is to sit whenever and whatever is happening. The patient will feel bad, he will be shocked. You can give him support, you can provide some tissue, water, but never ever say, I will postpone this meeting. However, this is a lengthy scenario. Even if you kept explaining all the task, still there is another meeting to get a consent. Still another meeting with the organ donation team to explain how the procedure will go, but not to say I will postpone the meeting. Okay, so we can arrange another meeting to explain more about this procedure to get a consent, but don't postpone the main meeting today, which is about the organ donation and the brain stem death. Okay, I hope it's clear, Dr. Ragad, and others,
Yes,
not only
Doctor
Dr. Ragad,
Masood.
because
Doctor,
I
yes,
heard.
here.
Yes, continue.
The difficult thing is to talk with someone from the in the Zoom because you are not seeing the patient. Sometimes
No,
when
no,
you
no.
are seeing the patient,
Believe me, the things you used to do in the session online, the same you will do in the exam. No, don't say I will be better in the exam. No, you know the exam will put more stress
no,
on
of
you.
course, of course, I will shuttle. Yes, you are right, Wallah.
Yeah, it's like a training session before your exam. So whatever you are doing here, you will do it subconscious in the exam. You don't have the time to think twice. What you have to say, you will do it without thinking. In the exam, everything will be more stressed and you will be more panic if you are not approaching properly and trained to do this approach during the online session. In the exam, you'll be more
Yes.
stressed, you'll be quiet, you don't know the idea what to do, what to discuss, what to raise, and
Mhm.
what the hidden agenda. Okay, so be sure that the training in this session will be much helpful to pass
Yes,
this exam.
inshallah. Then
Inshallah. Okay. Dr. Hannah, I hope you're ready so we can start.
Okay.
Yes, here you go.
Hello there.
hello.
I am Dr. Abdul is a doctor in the medical ward today. Can I confirm that I am talking to Mr. Ahmed and you are the son of Mr. Saleh?
Yes, doctor, I am.
Mr. Ahmed, I am here today to discuss your father condition. Is it okay with you?
Of course, doctor.
Okay, Mr. Ahmed, I want to ask if you want to anyone attend this meeting with you.
No, doctor, that's fine.
Okay. So before we start, Mr. Ahmed, can you tell me how much you know about your father's condition so far?
Yes, doctor. My father actually admitted up to 2 days ago when he has some soreness in his chest. And actually, I'm here today in order to know about his condition, and I suppose that he is better right now. So could you please tell me more about his condition?
Uh, yes, I'm sorry, Mr. Ahmed. Uh, as you said, your father admitted with severe chest infection. Uh, Actually, we admit him to the medical ward because there was no an ICU, I mean intensive care unit bed at that time. And
Doctor, please,
I am
how is the right now? I want to know his condition right now. Is he good or
uh, I am afraid actually that I don't have a good news for you.
doctor? What do you mean by not good news? What do you mean by that?
Uh, Actually, Mr. Ahmed, during your father's admission, his condition deteriorated rapidly, and his uh, his heart is stopped, and
What, doctor?
we
What do you? What? His heart is stopped? He is dead?
I am sorry to say that we try to revive him. We try to do resuscitation, but unfortunately he passed away. I mean, he died.
Oh my God, doctor, what are you talking about? I suppose that he is now in very good condition. I'm so shocked.
Actually, I appreciate your feelings, and I can see how this is difficult situation for you.
So, doctor, what's happened exactly? Why his condition deteriorated in such way? What's happened?
Yes. Sorry. I appreciate your feeling, Mr. Ahmed, and as I said, his condition deteriorated rapidly, and actually, this his case of chest condition was actually severe, uh, and I want actually uh, to say that there is some issue happened during his admission also.
Okay, what is this issue?
Yes, during his admission, this the lion in his hand, which is giving the antibacterial drugs or the antibiotic and fluids, it is dislodged, and it is missing of one of the dosage of this medication, antibiotic, I mean.
Oh my
Uh,
God, doctor, did you mean that my father died because of this mistake?
Actually, this is a mistake. That's right, and I apologize about this mistake. But this is mostly not the cause of his death. Actually, because his condition was severe. Actually, I admit that this is a mistake, and it is actually not our usual practice. Uh, uh, and not the usual standard of level of standard here in our hospital. And behalf myself and behalf the medical team, I apologize about this. How does it sense?
Doctor, how can I trust you after what I heard from you? And please, why did no one notice the dismissed antibiotic? Who is responsible for that?
Uh, Actually, uh, we are working here as a one team, and uh, we are all responsible about caring him and about his health condition.
So,
Uh, so, uh, are you with me, Mr. Ahmed?
yes, I'm with you, doctor.
Actually, I can see how this is upsetting you, uh, and actually, anyone would feel this way. Uh, uh, and I am here actually to help you. We actually about this happened. We will
Doctor, if you
investigate.
want to help me, just give me the name of the team that's responsible for this disaster.
Yes, I appreciate your feelings and I respect that. But as I said, we are working here as a medical team. I can guide you to raise your complaint uh, if you wish in the patient liaison advice and liaison office, uh, and I promise you to follow this complaint by myself. Okay, and update you about anything in this issue. How does it sense?
Okay, doctor. So Will this happen to, I just want to ask if this will happen to another patient like my father, how we can trust this hospital?
Yes, your concern is valid. Yes, we will actually about this. We will investigate what happened actually, and we will make a report about what happened. And already we informed our consultant and the risk management team. I mean, this the team responsible for discussing like this issue and to confirm this not will happen again to another patients.
2 minutes left.
So, do you have any other concern?
No, doctor, I don't have.
Okay, can I ask you some questions?
Yes, sure, doctor.
Okay, actually, first, our condolences about your loss, and if you need any help from our side uh, about the funeral ceremonies and death certificate, we will try to finish all this issue rapidly. Okay, and if you need any help from our side, you can tell us without hesitation.
Yes, doctor.
Okay.
Thank you. Okay, doctor.
Do you have any other concerns?
No, doctor, thank you.
Okay. Actually, I finished.
Okay, anything you want to add?
Uh,
Any
no.
team to be added here?
Kroner, I don't know about Kroner. It is need to. Yes, we will refer this to the Kroner. Yes, this. Yes, because it is this in the hospital.
No, it's not the corona, something else. I think Dr. Sahar wrote it now. Yeah, the bereavement team. Yes, you're right.
Mm,
Bereavement team to help for the support. Okay.
okay.
Yes, time is up. We'll discuss about this scenario now, Dr. Ragat. You can comment, then I will comment.
Okay, well done, Dr. Hani. Actually, you covered the concerns of this scenario. And I was sort of with you, sorry.
No, no problem. No problem.
Okay, so I just talk about the scenario. I will start, okay, from the beginning. Okay, we can start actually by from the start. The patient already he is not uh, he expect to see the father in a better condition. So I will start by hello, Mr. Ahmed. I am doctor, one of the doctor in the medical ward today. I'm sorry that we are meeting under such difficult circumstances, but I want to talk with you about your father condition. About the if we need to invite other one, I don't know, Sarah, about this. If
No,
we
no, he can. As I said earlier and before, Dr. Ragat, the death, this is the worst news ever, right?
oh, okay.
So
Oh,
you
okay.
can
So
invite in this such news to support the surrogate or the relative to absorb what
yes.
will listen. Okay, continue.
Mhm. So we can start by after the patient. Yeah, actually, your father was admitted to our hospital with the severe chest infection, and his condition was very serious from the beginning. And because there was no bed available in the medical ward at that time, he was admitted to the surgical ward temporarily. But what I am about to say may be upsetting for you, but unfortunately, I need to tell you something very serious. Unfortunately, during his stay, his his line of his line through
Okay,
his blood channel
Dr. Raghat.
become
Yeah,
yes,
okay. Before moving to this step, do you
yes.
think admitting the patient in the world is a wise decision? He has CARB score 65 of 5. CARB
As
65 or score of 5. Is it hospital admission only or ICU admission?
actually depend on this curve, he need admission to the intensive care unit from the beginning.
Perfect. Yes, you're right. So this is a first and very important mistake to address.
But this
Okay.
is systemic the system mistake, as there is no bed available.
No, this is not a solution. If the
Okay.
patient, so you have to address this mistake and to admit
Yes.
there is a mistake earlier that he should be admitted in the ICU, and unfortunately there was no bed. The other mistake will be for the dislodgement of the cannula. Continue.
And the line through his blood channel become dislodged, and he missed his one dose of his anti-bug medications. So his condition deteriorated, and he was immediately transferred to the intensive care unit. But unfortunately and sadly, he had his heart stopped from working, and despite all our resuscitations attempts, he passed away. So please accept our condolences on the behalf of our medical team. I'm very sorry for this shocking news, and uh, I I admit that this is a mistake, and for that I am here to apologize on the behalf of our medical team, and this should not be happened, and I want to sincerely apologize about that. And this is not our intentional practice, and this should not have be happened. So we will start conduct our full investigation regarding this incident in order to understand exactly about what happened and why this happened, to make sure that this not happen again in the to the another patient. And for that we will involve our consultant and also nurse in charge, and also we will involve a special team that we will investigate about the events of this incident thoroughly. And once the results of these investigations become available, this will be discussed in a meeting, and we can also update you about the results of this investigation if you want. And we should also like uh, uh, understand this is of course must be very upsetting and shocking for you, and we are very very sorry for your biggest loss, and we are here to support you okay. Regarding the concerns, did my father die because of my mistake? Uh, we will answer, I understand why you would ask like that. And your father actually once admitted to our hospital was very unwell with the severe chest infection, which can be a life-threatening condition. And missing one of those of his anti-bug medication may contribute to his death, but I cannot tell you for sure that this is the only cause of his death. That's why we will need to conduct full investigation about what's happened to understand exactly why this happened. And if he asks who is responsible, as you mentioned to him, we are here working as a medical team. This is our mistake as a management team. No one responsible for that. And he is in our hospital. There is a system, and so for that, this is our responsibility. And why he was, if he asked why he was admitted to surgical ward, not to the medical, we will tell him at that time there was no bed available in the medical ward, so we admitted temporarily to surgical ward in order to start him the treatment as soon as possible without delay. Uh, and but even once admitted to surgical, he remained under our care. But this is not justification, and I'm not justify this action. And why did not one notice his missed antibiotic? This is very valid question. Actually, as I told you, this should not be happened, and this is very unacceptable. And we are exactly not know why this happened. So for that, we will investigate about that to know why this happened and where is the defect in order to improve our quality of services. If he can I make complaint? Of course, yes, he can. You can make and I can guide you to do this process by give you the address of the um, advice الPulse
Patient
patient
advice liaison
yes
services.
Pulse patient
Pulse
advice
services.
advisory yes to do a formal complaint and I can guide you. Okay. Uh, okay, will this happen to another patient? Um, yeah, I appreciate your concern, and we will take this very seriously. And also, we will uh, do our best and full investigation in order to prevent this from happening again and be sure this is not our usual practice. And we are professional and safe doctor, but even with a professional team, the mistakes could happen. And this is the points of this. And yes, as you can also provide him about the services of bereavement services for more support. This is the scenario from my point of view.
Yes, perfect. Yes, this is the way to address it. I posted in the chat box the mortality rate of score 5 for CARB 65.
Yes,
So reach 50,
57%.
yeah,
Mm,
57, more than 50%. So it's
mm,
expected to have that. No need here to discuss either or neither the postmortem nor
yes.
the coroner. Okay.
Mhm.
And the patient already admitted 2 days ago. So it's not within 24 hours. When to discuss the postmortem, if the patient showed any improvement, significant improvement, then sudden deterioration or all of a sudden cardiac death or cardiac arrest. But this patient, since admission, he had a score of 5 and he has very bad or he had very bad pneumonia with a high mortality rate reached, as I showed in the chat box, 57%. So neither post-mortem nor the coroner to be discussed in this scenario. Okay, the only thing here as a task, breaking bad news plus support. Okay, and the medical error and
Medical.
breaking bad news. Yes, plus at the end you can have us or provide support. But the most important here, the admission decision and or not having availability to admit the patient to ICU. This is an error. This patient should be admitted to the ICU from the start because of the score and the severe pneumonia he had. Again, provide the bereavement team, show the sympathy, condolences for the loss, and the support for the living person with this. I mean, the family lived with this person.
What is the work of
And
bereavement team, Dr. Asus?
sorry,
Bereavement team, what is his work?
they are supporting post mortem or post death. Okay, I posted before the team who can support after the death of any patient. They are the same definition of this. So the team who assigned to support people or the family after they lost a beloved person called bereavement team. Okay, so they are supporting for this issue only, not only bad news. No, only for the people who has loss. Okay, they support the family.
This is a team in the hospital
Yeah, in
in
every
UK?
hospital. Yeah, it's by the way, it's not a team only for this. No, they are from the social team to support. Okay, so maybe one or two of the social team in the hospital, they are assigned to sit with the people or with the family after they have loss. But they put as a term of the bereavement team to sit with the family after the death. Okay, it's a good point and positive comment whenever you mention this team. They will give you good comment that you mentioned this team. Clear, Dr. Hani?
Yes, yes, clear. Thank you.
Okay, it's a team after death, as I said. Any other comment or
Mm.
question for the second scenario? Any question, Dr. Hani?
Thank you, Dr. Basim. Jazakallah khair.
Yeah, uh, as I said, you did it perfect as usual. You cover all the concerns, but the error of admitting the patient with CURB 65 score of 5 need to be as ICU patient. So it will be another mistake in this scenario. So you will add it to your mistakes. Dislodgement plus admission or wrong admission to the ward. By the way, the missed dose of antibiotics, as you said, it will not affect the whole outcome. Okay, but still, it's an error and should be addressed and investigated why this happened. And this is not our usual habit or practice. We take care during transportation. We take care of the line, not to be dislodged. Anyway, if it happens, there is a mistake, and we will investigate regarding this, and we'll update you about the result of investigation, as well as for the admitting to the wards without having a bed in the ICU. So we'll investigate both, and we'll let you know. I want to complain. This is your right. I will guide you to the office. It's called PALS office, Patient Advice Liaison Services, and this one, be sure that they will listen to you, and you can file a complaint. And this is not our usual habit. We usually take care of our patient. Be sure will not happen again, and if happen, it's unintentional in this way. But don't say it will not affect your father care because already he's dead. You cannot say this. Okay. Any question regarding first or second scenario?
Thank you, Dr. Basim.
Okay, thank you.
Thank
Uh,
you, Dr. Rafi.
yes, Dr.
Yes,
Basim, can I ask one question
Dr. Ala.
regarding
Yes, sure,
the second scenario?
sure.
Because I saw this scenario many times. I don't know if it's coming recently on the exams,
Okay.
and it's a difficult scenario I can see. So I don't know if it's better we convey the message of this firstly, or tell all the events that happened to the patient, then we convey the message of this. And that's the thing that confusing me. Should I say that his condition deteriorated and his heart stopped, and unfortunately he died? Please accept my condolences. Then after that, I go back to the event that happened, or I should say the event, then convey the message of this.
No, no. First of all, check the understand and the
Mm,
expectation of the relative. Okay,
mm,
and check if she's expected or he is expecting him to die. Then say yes, he's died or he is dead. But if
mm,
the relative expect him to improve, now you will start by preparing him for the bad news. Unfortunately, the condition deteriorated later on. Then it lead to his heart to stop, and we start to survive him. We did a lot of effort. Unfortunately, it didn't help, and your father already dead. I'm so sorry to say this news. You
Yes.
know, in real
I,
practice, Dr. Ala,
mm, mm,
I'm trying to prepare the family because I'm working in ICU. Okay,
mm,
whenever the relative ask me, doctor, is my father or if is my relative dead, I will give him the news. I'm waiting for his expectation to say yes. I expect him to say, or I expect you as a doctor to tell me he's dead. Whenever I hear that, I will tell him I'm so sorry to say yes, he's dead. Or I'm afraid to say yes, now he's dead. Inna lillahi wa inna ilayhi raji'un, as we do in our practice.
Mm.
But if the family is not expecting his death, this is the time to go back and to prepare him for the bad news until he will tell you, doctor, you mean that he's dead? Yes, I want to say that. You got it?
Yeah. I mean also the other surrounding event, this cannula dislodgement and the admission to the the surgical ward should also be included, or just mentioning that
Yes,
his
yes,
condition deteriorated and he died, then mentioning these events after this.
yes. I agree to mention it earlier,
Mm.
because if you mention the death, you will not have the time to to say about the dislodgement or the admission to the wrong ward. So I prefer to start by this way. But if the family expecting bad news and she asks you, doctor, do you want to say that he's dead? You can say yes, honestly, and unfortunately, I'm afraid to say, I'm so sorry to say your father already did. Then try to to mention the circumstances that the patient passed through. But be sure that
Okay.
you will mention it because it was written in the scenario.
Yes.
Nothing,
Yeah.
yeah, nothing written in the scenario for no reason. It's written there to mention it to the patient or to relative. But as again, check for the understanding and the expectation earlier. If the expectation for death, proceed for the news of death. But if the relative expecting him to be fine and to improve, to be discharged, no, this is the way to start to prepare him for a very bad news by saying the circumstances happen from the start, even from the admission, that he had a very bad pneumonia or chest infection, which necessitate him to be in ICU. Unfortunately, there was no bed, and I'm so sorry for that. We admitted him to the ward. Although we give the maximum support and care, this happened. And one of the mistakes also that there was a cannula dislodged during transportation, and unfortunately, your father is dead now. We are here to support you, and we'll investigate about these mistakes, why this happened, and we'll update you about the result whenever available.
Okay.
Clear? So it depends on the expectation of the family or the relative you are sitting with. Clear now, Dr. Ala?
Yes, Dr. Best. It's clear.
Okay, thank you. Any other question before ending the session? Clear for all? Okay, thank you, Dr. Hani, Dr. Ragad, for
Thank you,
participating
doctor.
today. Thank you,
Thank
everyone,
you.
for the attendance. See you tomorrow, inshallah, with the short clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.